I've always enjoyed kids. I've always liked working with kids. You never know when you ask them what they want to talk about at this visit. It might be a runny nose, it might be Spider-Man, right? You never know what's going to come up, and I've just always enjoyed that. When I'm first meeting a family, I always want to, ask them what their goals are, what their questions are, what they're hoping to achieve from the visit. Just get to know a little bit about them and their background, their medical background and their social background, and just really help to get on the same page with them. And then we can start, tackling the problems one by one from there. Regardless of the age, I always try to talk to the patient first. Even if they're a baby and it's a little bit silly to address them directly, I always want to talk to the patient. And as they get older, you can become, more and more interactive with them, because sometimes the child and the parent have very different concerns. Their worries are not the same. They may want to talk about different things. And you start building that trust and building that bond, and kind of giving the child some ownership of their own healthcare. In pediatrics, we have that unique opportunity to kind of teach kids what's healthcare like, what's going to the doctor like. If they enjoyed their time with their pediatrician, they're going to be more likely when they're older to seek care. They're not going to be afraid to go to the doctor, hopefully as a lifelong thing. A huge part of my job as a pediatrician is education, and really answering patients' questions, making sure they know that it's a safe, open space to ask questions, that there's no such thing as a silly question. And if we, need to spend our time talking about sleep training and tantrums and, formula and solid foods, that's just as important as talking about an ear infection or, vomiting or something that we may see more traditionally as a healthcare problem. Those behavior problems are just as important, and parents have questions about that stuff too. Watching the kids grow, seeing them, sometimes on day 2 of life, all the way up through, going to kindergarten, going to high school, and really building that trust with them, seeing that change over time is really rewarding.